Hello, my name is Alex Wright, and I'm here to talk to you about multiple sclerosis, or MS. MS is a disease in which the insulating covers of nerve cells in the brain and spinal cord are damaged. MS was first described in 1868 by Jean-Martin Charcot, and the name multiple sclerosis refers to the numerous scars or sclera, also better known as plaque or lesions, that develop in white matter of the brain and spinal cord. Now, the best way to describe demyelinating disease such as multiple sclerosis is you take a 6-foot regular extension cord. This represents your spinal cord, and the top of the cord, where you would plug it in, that's your brain. So you take this cord and you nick it slightly on the sides, just a little bit, and it may do nothing for a long time. It would still work. You could still plug it in and use it. But then imagine you nick it one more time and you take out a little piece, and this disrupts the electrical flow beyond repair. So you're plugging it in, you're plugging your brain in, and it's not working. Your spinal cord is not working. This is kind of what happens with MS. The brain is fully aware, but the body doesn't respond to the stimulus. This damage to your spinal cord disrupts parts of the nervous system to communicate, and it can result in a pretty wide range of signs and symptoms, including anything from physical symptoms, mental symptoms, and sometimes you can develop psychiatric problems. To be a little more specific about the symptoms, they can include anything from double vision, blindness in one eye, muscle weakness, trouble with sensations like touching or physically feeling something, and you can also have loss of coordination. MS can take several forms, with new symptoms either occurring in isolated attacks, that is the relapsing form of MS, or when the symptoms build up over time and they get progressively worse, and we call that progressive MS. Between these attacks and relapsing MS, the symptoms may disappear completely. However, permanent neurological problems often remain as the disease progresses into the body. Multiple sclerosis is the most common autoimmune disorder affecting the central nervous system. 2013, around 2.3 million people were globally affected. And each year, around 20,000 people die from MS. It's a way huge increase from 1990, where only 12,000 people died. The disease usually begins around the ages of 20 to 50, and it is twice as common in women as in men, and there is no cure for it. Treatments usually aim to improve functions following an attack, and they attempt to prevent new attacks as well. Some of the medications commonly used to treat multiple sclerosis are, at best, moderately effective, and a lot of the medications have side effects and are just poorly tolerated by the patient, whether they don't like using them, or they're hard to use, or the symptoms of the drug just are worse than the symptoms of MS. Some of the more common drugs used to treat multiple sclerosis are Rebif interferon and Copaxone. The interferon drugs and Copaxone are considered to be fairly safe, and most of the side effects that do occur result from the injections themselves. It'll leave your skin itchy, red, it'll give you weird spots. With the interferon drugs, however, it is common to have flu-like symptoms, and you'll feel kind of achy, fevers, chills. It'll make you stay in bed for a couple days. But typically, those symptoms fade after a few months. The interferon drugs can also slightly decrease your ability to fight infections, as it lowers your white blood cell count. So you are more prone to minor illnesses as well. In some of the more severe cases of MS, doctors may prescribe toxantrone or other drugs that are designed to treat chemotherapy in cancer patients. They aren't really designed for MS, so it may result in plenty of other side effects from hair loss to many other things that people result from when they receive chemotherapy. There are other drugs. Novatrone. It is used sparingly. The FDA has a warning label on it that it creates heart damage and can potentially develop leukemia. Most of these medications are designed to prevent flare-ups, but you can still have flare-ups that can interfere with your ability to get around, to go to work, to communicate with your family or your boss or anything like that. Some of the more mild flare-ups will go away on their own, and you don't really need to treat them. However, if the flare-ups are so bad that they're getting in the way of your life, doctors prescribe steroids typically, whether they give you an injection or you take oral steroids. They typically speed up your immune system and help you get over those flare-ups. However, the steroids will not slow down the disease whatsoever. Many patients also choose to use forms of physical therapy to help with their movement or their hands or any other problems that they might be having with their motor functions. Long-term effects of MS are kind of hard to predict, with good outcomes more seen in women, those who develop the disease early in life and catch it early, those with relapsing forms of MS, and those who initially feel the attacks and recognize them and go see a doctor. Life expectancy, on average, for multiple sclerosis patients is 5 to 10 years lower than someone who is unaffected. In terms of communication, with multiple sclerosis, it's very important that you just convey your feelings and how you are on a day-to-day. As the symptoms are kind of hard to describe and they aren't visible, so you're just kind of feeling all these things, and it's hard to communicate to them when they aren't afflicted with the disease as well. In terms of communication with family, I've experienced this firsthand. My mother has MS, and I've seen it for a very long time, slowly progress itself through her body, and she's experienced lots of flare-ups and lots of different types of symptoms, and it's up to me and my family to just be in constant communication with her and be as helpful as I can on a day-to-day basis. That is all I have for you today. I hope you learned something, and I hope you enjoyed my presentation on multiple sclerosis.